New research from federal health officials say 1 out of every 5 U.S. teenagers has high cholesterol. 1 out of 5. And it's increasing their risk of heart disease in the future. New evidence that obesity is making more children prone to illnesses once primarily thought to be limited to adults. Joining us now is the author of the F Factor Diet, Discover the Secret to Permanent Weight Loss, nutritionist Tanya Zuckerbrot. Good to see you. 30% of teenagers are overweight?
30% are overweight, 15% are obese, and out of those 15%, 40% of them have elevated cholesterol levels.
And the other thing I read in the CDC report is that roughly 14% of non-overweight kids have high lipid levels, high cholesterol, too. So what is it, lifestyle that is causing this, genetics?
Well, when we look at the difference between the percent of normal weight children, that's 14% have elevated cholesterol, and then how that quadruples to 40% of the obese kids, we can see that weight does play a factor in elevated cholesterol levels. Of course, there's a genetic predisposition, but lifestyle truly adds to it. The more overweight you are, the greater the chances that you have elevated cholesterol levels.
I talked to Dr. Mark Siegel about this. He says all kids ought to have their lipid levels tested on a regular basis. Doesn't mean you have to take statins, but just have yourself tested.
Correct. Well, this is where the controversy lies, is that the American Academy of Pediatrics has new guidelines set. They believe that all children over the age of 2 should get their cholesterol tested, and the most controversial part of the guidelines is that they are recommending statin drugs for children as young as 8 years old. Now, that's a big problem. First of all, this has not been tested as far as long-term use of statins, especially in someone so young. We don't know if there's going to be cognitive impairment, growth, development issues.
Liver damage, which can happen in adults.
And once again, these statins are just putting a Band-Aid on the wound. Let's treat the problem, and that's where lifestyle comes into play.
Talk to us about that. What do you recommend?
I have some great tips today. Number one, it begins with the parents. It's a trickle-down theory. You can't recommend your child to eat healthier if you're not following suit. It's hard for a kid to be stuck eating carrot sticks when you're sitting next to them chomping on potato chips. So the parents must lead by example.
What about fiber?
Fiber is a big issue in this country. We're in a fiber deficit. We've refined all our foods. We've taken whole grains, and we have white breads, white rice, white pasta. These foods not only, increase our sugars and make us come crashing down, increasing the risk for cardiovascular disease, but refined carbs also increase triglycerides, which are part of the cholesterol lipid panel. So replacing refined carbs with high fiber carbs is a great step to lowering cholesterol.
Soft drinks, bad idea, right?
Yes. An average big gulp at 7-Eleven, we're talking 800 calories. If you have a child or a teen who's drinking one a day and they cut that out, they could lose 80 pounds in 1 year.
And a nutritional breakfast, as well as lots of exercise, is also on your list of tips. Thank you so much for being with us, Tanya Zuckerbrot. Good
My
ideas.
Pleasure.